Hey guys, it's Dr. Chris of MC Chiropractic. We're back with another Fitness Friday. Today we're talking about anterior pelvic tilt and why it's wrecking your breathing, okay? Most people have somewhat of an issue with this, especially if you're dealing with some low back pain or difficulty lifting things, if our core feels weak or we just aren't very strong at lifting. We can usually improve it by getting rid of this issue, but not everybody needs it, so let's find out how it affects us and if it's a problem for you with these easy to follow along tests at home, okay? What is anterior pelvic tilt? What we're talking about is this line here between our hip bone, that one that comes just a little above your waistline, and our ribs right here. We want normally to be in a nice neutral position, a parallel line between those two, okay? We don't want to be in this anterior pelvic tilt, tilted this way, and we don't want to be in a posterior pelvic tilt, tilted this way. We want to be somewhere right in the middle, fairly parallel on that line, okay? So, how would anterior pelvic tilt affect your breathing? Well, if we take a nice deep breath in when we're in parallel, that allows us to get the most air in using our diaphragm. If we're in an anterior pelvic tilted position, it actually limits how much air we can breathe in with any given breath. To show you that, I want you to try this test with me. If we extend into this position, we're forcing ourselves into a weird anterior pelvic tilt. See these lines? They're open up like this, they're not parallel, okay? We're gonna try to take a deep breath and then come back up to this neutral position where we're parallel and see if we can breathe in any more on top of that previous deep breath. If you can, you're gonna feel the difference that being in a neutral position makes to allow you to breathe deeper. So we're gonna go back, we're gonna breathe in all the way. Come back up. I was able to get in probably another quarter of my breath there coming back up, okay? It's much more comfortable to breathe, but if I'm in the back all the way here, I can breathe way more in when I come back up to neutral, okay? So, how do we go about fixing that? We're gonna use something when we get down on the floor called Brugger's position relief. We'll see you right after the bumper. Okay guys, so we're down on the floor. We're gonna do something called Brugger's position of relief. It is a great place to start to get our diaphragmatic breathing down. That's using your core the way it's supposed to breathe. It's usually very relaxing for people to do, so especially if you're having some sort of low back pain right now, when you get in a lot of pain, breathing gets difficult for people who start taking short little panting breaths. This is a great way to breathe deeper, relax some muscles around your midsection and lower back, and actually decrease your pain. So sometimes this is where we have to start when patients come in and they're in a lot of acute pain. We actually do need to just get them out of pain first, get them calmed down a little bit before we can start doing some bigger movements. So we're gonna lay flat on our back with our knees bent, okay? We're gonna get in this position and we're gonna just kind of self-assess when we're in a relaxed position. Do we have a big arch underneath our back here, or are we pretty flat to the floor, okay? For a lot of us, just laying here, especially with our feet down, we're gonna notice there's a huge arch underneath us here. That's that anterior pelvic tilt we were talking about. So we're gonna put everything in our favor if we can. We're gonna bring our knees up. It's gonna relax some of our hip flexor muscles and get us a little closer to flat on the floor. We're gonna go ahead and deep breathe in. And breathe out nice and easily. Relax our arms out so our shoulders and our chest actually open up into this position here. And we're just gonna practice deep breathing. Now, some of us are gonna notice that it still doesn't feel like your back is on the floor here. That's what we're gonna try to fix with this exercise, okay? If you're still arched off the floor and you don't feel anything contacting the floor when you breathe in all the way like this, okay? We're gonna work on that, relaxing our body down, gently letting that open up into the floor as we breathe deep. We're trying to expand these lower ribs down into the floor with each breath. Putting our hands open, again, opening the shoulders can really help us a lot. And we want to be belly breathing here, okay? Now it's not the time to suck in that gut. We're going to go ahead and expand with our diaphragm, push those abdominal contents down, let our ribs actually open up and relax all the way down with each breath. And for most of us, what we'll notice after about 10 repetitions is we'll be a lot closer on the floor, maybe all the way on the floor. That puts your body into that neutral line here. Our pelvis and our ribs are actually coming into a parallel line. This is neutral core position. This feels good on most low back issues, okay? So a lot of times just getting somebody into this position, they'll reduce their pain or sometimes even eliminate their pain. Sometimes people are noticing, hey, maybe you're that person that says, I can only sleep on a firm floor like this, or maybe if I put my feet up on something, it's the only way I can get comfortable with my back. That's probably making you a good candidate for anterior pelvic tilt. So, Brugger's positional relief. We try to get into this position 3 to 5 times a day for 10 deep breaths if you're in a minor amount of pain. But if you're hurting and can't do anything else, even putting on your shoes or your clothes is a difficult challenge. You might be here for several rounds in a row just to get that pain down from that 10 out of 10 down to maybe a more manageable 6 or 7 so you can actually get it somewhere for some care. Doing this is a great relaxing technique before bedtime, so make sure you get in some regular breathing throughout your day. Start practicing your deep breathing with Brugger's position relief. Just like that. Actually feels really good and relaxing. Even if you're not having low back pain, breathing deep just feels better. Remember, we're always here at Adventure Chiropractic to help you move better, feel better, and be a better you. So come in, let us check out what you have going on if you need a little bit of help. But start with this at home. See if it doesn't improve your life just a little bit each day by trying it out.
Everybody's moving, everybody's moving, everybody's moving, 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 moving. Everybody's moving, everybody's moving, everybody's moving, 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 and stop.